You're active, you feel great, and then bam, one morning or one wrong move, and it happens. You get this sharp, frustrating pain in your foot or your ankle that just stops you in your tracks. Okay, so today we're gonna dive into this and figure out what's really going on when this super common injury strikes.
So, picture this. Here's our first person of interest. She just crushed a 10K race, feeling on top of the world. But the real challenge? It starts the very next morning. That first step out of bed is just excruciating. I'm willing to bet it's a story that some of you might find painfully familiar.
And then, let's meet our second case. He's a weekend soccer player, makes a sharp cut on the field, a move he's probably made 1,000 times. But this time is different. His ankle just twists, and he feels this sudden, hot surge of pain.
You know, for both our runner and our soccer player, it's really easy to just say, my foot hurts. But if you're a doctor trying to solve the problem, that's just the very first clue in a much deeper investigation. So yeah, let's put on our detective hats. When a doctor starts investigating foot and ankle pain, the whole process really hinges on your story and a physical exam. And you know, the most important first clue isn't what the pain feels like, it's exactly where it is. Okay, so let's get back to our runner with that awful, sharp heel pain. The very first question a doctor is going to ask literally splits all the possibilities right down the middle.
And here it is, that crucial fork in the road. Is the pain on the bottom of the heel, what we call the plantar surface, or is it on the back, up near the Achilles tendon? Just answering that one question dramatically narrows down the list of suspects. And since our runner's pain is right on the bottom, well, now we know exactly which trail to follow.
This gives us a lineup of the usual suspects for that bottom of the heel pain. Sure, it could be a stress fracture, or maybe the fatty heel pad is wearing thin, or even a nerve issue. But the prime suspect, by a long shot, the most common cause is plantar fasciitis. So, with plantar fasciitis as our main suspect, the investigation now gets laser focused on confirming it and ruling everything else out. And this pretty much comes down to a few clever, hands-on tests that happen during the physical exam. And here's why this is so important to nail down. A full 10% of people will deal with this exact condition at some point in their lives. I mean, think about that. That's 1 in every 10 people. It's incredibly common, especially if you're on your feet a lot or you suddenly ramp up your activity, just like our runner did. Now, this is one of the coolest diagnostic tools. It's called the windlass test. It's so simple. A doctor just gently lifts your big toe. That's it. That movement puts the plantar fascia under tension. And if doing that one thing brings on that same sharp pain on the bottom of the heel, well, that's a huge indicator. In fact, some studies show it's basically 100% specific, meaning it's exceptionally good at confirming the diagnosis. And just like that, the mystery for our runner is solved. The pain, which is always worst with those first steps in the morning, and now it's been confirmed by that physical exam, it all points directly to plantar fasciitis. Okay, let's switch gears. We're going back to our soccer player. He's got this swollen, painful ankle, and for him, the diagnostic process starts somewhere totally different. The first, most urgent question on everyone's mind is it broken? And that leads directly to the next big decision. Do we need to get an X-ray? Now get this. This is a really crucial point. While it feels like almost every acute ankle injury gets sent for an X-ray, only about 9 to 15% of them actually show a fracture. So what does that mean? It means up to 90% of those X-rays might be totally unnecessary. The vast majority of these injuries are soft tissue damage, sprains. And that highlights the need for a really reliable way to decide who actually needs to get zapped. And that's where this brilliant clinical tool comes in, the Ottawa Ankle Rules. Think of it like a highly sensitive checklist. A doctor checks for pain in these key bony areas around your ankle, and then they ask a super simple question. Could you walk 4 steps right after it happened? And can you do it now? If there's no tenderness right on the bone and you can bear weight, you can probably skip the X-ray. So, our soccer player, he could walk, but it was really difficult. And his exam showed some moderate swelling, but no major instability. So if we look at this chart, he fits perfectly into a grade 2 sprain. See, this isn't just a stretched ligament like a grade 1, it's an actual incomplete tear. And grading it like this helps guide the entire recovery plan. Okay, so we've got a diagnosis for our runner and our soccer player. Now let's talk about the most important part, getting them back on their feet. And the good news here is that the most effective treatments are often the simplest ones. Let's start with our runner. I mean, this quote is just incredibly powerful. For plantar fasciitis, surgery is almost never the answer. Conservative, do-it-at-home care is highly effective for the overwhelming majority of people. And this is what that first-line care looks like. It's really just a combination of rest and icing. And by the way, rolling your foot over a frozen water bottle is a fantastic trick. Then you add in some specific stretches for your calf and the plantar fascia itself. You use supportive footwear, and this is a big one. You avoid walking barefoot on hard floors. Consistency here is everything. Now, for our soccer player's grade 2 sprain, the initial playbook is all about that classic acronym PRICE. That's protection, maybe with a brace, rest to avoid making it worse, ice to control that swelling, compression with a bandage, and elevation to help drain fluid away. This is really the cornerstone of care for those first 2 to 3 days.
So, we followed our 2 cases from the moment of injury through the diagnosis and into treatment. What are the big picture lessons that we can all take away from this to be a little smarter about our own foot and ankle health? Here's the bottom line. First, remember that where it hurts is the single most important clue you can give your doctor. Second, as we saw with the windlass test and the Ottawa rules, a good physical exam can often tell you way more than an X-ray can. Third, please don't underestimate the power of simple, consistent, at-home care. And finally, just knowing how a doctor thinks about these problems helps you ask better questions and become a true partner in your own recovery.
So we'll leave you with this thought. Armed with this knowledge, you're not just a patient with foot pain anymore. You're an informed participant who actually understands the diagnostic trail. So how does that empower you to take charge the next time your body sends you one of those painful signals?